One of the big innovations in facial rejuvenation has been the growth and the expansion of non-surgical facial rejuvenation. This is an area that I kind of went all in on in the 90s. And back then, just to kind of set the stage, a lot of people don't realize, but plastic surgeons didn't do injectables. That was the dermatologist's job. And the dermatologist didn't do surgery. That's the surgeon's job. And when I entered this field, I kind of saw the value of all of these things. So we focus on the face, but I wanted to be as comprehensive as possible in offering all the alternatives to make the face look better. We bought our first laser in 1999. I started injecting Botox in the 90s before it was even FDA approved in 2002. In fact, I had my first Botox training session where I trained some dermatologists here in Atlanta in 1997. So Botox has been kind of an old hat thing for me. When Botox first became FDA approved in 2002, I was in the very first group of trainers, trained probably over 500 plus physicians and nurses in how to properly inject Botox. A lot of fun. It was fun getting a free trip to different cities and hotels, but you know, after about 10 years it got kind of old. I still do it a little bit, but it was really great to be there on the forefront of when all of this stuff comes out, when all of this stuff came out. Juvederm helped launch that. Restylane really was one of the first when that came onto the market. So it's been very exciting watching all these new technologies come on and using them in my practice and gaining a lot of experience in my practice. Likewise, lasers and devices, fractional CO2 laser therapy. We were actually the very first practice in the world to have a fractionated CO2 laser machine built by Coherent, later Luminous Systems. We actually helped develop it, did a lot of the clinical protocols, and I have machine number one, which maybe I'll donate to the Aesthetic Museum one day. As well, things like RF microneedling and PRP and some of the newer technologies that have come out just make this whole specialty very exciting. It's our goal to kind of see what is the latest, greatest things, both surgical and non-surgical, and put them together, and more importantly, ferret out the ones that actually don't work. We let other people work on their patients for that, but thankfully I have a pretty big network of plastic surgeons around the country and around the world. We talk during training sessions, I figure out what's great, and then once we see something is very promising and gives good results, we bring it into our practice and offer it to our patients.